In the fall, we came in here and we just lost another one of your classmates. And I told you at that time, I was looking at my notes the other day, I'm really concerned that we have 4 students in our graduating class that are not with us anymore. I'm really concerned that 3 of those 4 are due to overdoses. And I'm not here to hide it. We all know it. We've talked about it. And you need to be educated with the facts. What Deirdre is going to tell you here pretty soon is that our student body is very healthy. Compared to the national norm, we're below in many levels of chemical use. Yet I still hear the perception that everyone does it, and that's garbage. And that's what you're going to hear today. And I need you as future graduates of this school to go out and tell the truth. When somebody says everyone's doing it, you're going to say, no, bull, only this percent are doing it. And those of you who aren't doing it, you're in the majority. You're in the in-group. The ones who are, you're the minority in this building and in this community. You're going to hear a statistic here shortly that 40% of the students in our building have a friend that they're concerned about. The way you respect Caleb's life, Dylan's life, Alex's life, is to offer help. Ms. Flynn from FCD is here from Hazelton Betty Ford. She's going to talk about the data for about 20 or 30 minutes just to give you a snapshot. Okay? Thank you.
There's lots of good news in this survey, and I think the really good news is just basically that Chanhassen students are generally, largely making healthy decisions and responsible decisions regarding alcohol and other drugs. This was a survey that was administered, if you'll remember, in early December from grades 9 through 12 at the school, the whole school. We ended up with 1,375 surveys. Our goal was to find patterns. Our goal was to find trends. Our goal wasn't to find a few people and what you're doing and pick you out of a crowd and try to fix you. Our goal was to have ideas about what you think, what you feel, what you're doing, and what you think other people are doing, so that we can help promote the Chanhassen prevention plan in the school. I don't think there were really any surprises in the survey, except that what you hear about this environment, what we hear in the news about Chanhassen, is all the trouble that they've had. And they have had an inordinate amount of trouble in the past with students in substance use. We know from the survey that 74% of students are reporting, the ones who drink, 74% of those students are reporting that they're drinking at a friend's house. 10% of those students are reporting that they're drinking at home with their parents' knowledge. So the vast majority of students here who are using alcohol and potentially abusing other drugs are doing it at home. They're not doing it here at the school. The school is really making a lot of effort and really taking strides in prevention. It's important for parents to understand that, number one, if they work together with the school in prevention, the effect is much more significant.
We focus on adolescent chemical and mental health in every grade level in personal wellness. We have a school liaison officer who talks to students about chemical use. Kids have heard the same message since they were in elementary school. Don't use drugs.
For parents that are wondering what they should do for prevention, I think it goes back to, there's several things. One is to keep thinking, how do you model? How do you model a good day, a bad day? How do you model stress, conflict resolution? Because, and more importantly, how do they model socializing?
I think the biggest thing that students learn from my whole department is the fact that making a healthy choice is not easy. It depends on your morals and your values and things that are truly important to you, and then when those are in place, then it's much easier to make a healthy choice.
Some of the action that parents can take is, number one, talking to their students about alcohol and other drugs. And it doesn't have to be a lot of information about the actual substance, but just talking to their students about it. And I think the second most important thing is then listening to their students, listening to what their kids have to say, listening to their opinions and their ideas and what they think, and remembering that it's not reality and that it is opinions. And talking and listening can really open up the conversation and get some of those misperceptions about what other kids are doing, what other kids are thinking, out on the table so that they can really discuss them and pull them apart.
So my takeaway from tonight was that we need to talk to our kids about everybody's not doing it, educate them about the numbers, about maybe who is doing it, and again to talk about how we're modeling behavior.
The statistics showed that the expected numbers of students that use is always higher than the actual number of people that use. So it's nice for students to finally see that in numbers, that it's less students than they think.
I think today the thing that stuck out the most was the statistics that weren't really what I expected, and I was excited to see how they turned out. It showed that a lot of the majority isn't using, and that was cool to see, since sometimes we can think differently based on social medias.
I would say for the underclassmen to find a good group of friends that help you stick to your morals and keep you on track with good choices in high school.
This is not a student problem or a problem of just 3 kids that have lost their life. This really is a community problem, and we must address it as a community problem.
Today was really about providing facts to our school community about how healthy our students truly are. And I think the thing that I'm most proud of is that the vast majority of our students are making very, very healthy choices.